I'm Dr. Sreekanta Swamy, Senior Consultant in Neurology at RV Aster Hospital, JP Nagar, Bangalore. I am here to give you some information regarding stroke or a brain attack. Now, many people want to know how to identify the stroke. I will try to briefly tell you about how to identify a stroke. The main thing, the problem in stroke is that whenever there is a blood flow decrease or there is any rupture of blood vessel, the symptom depends on which part of the brain that is affected. It can affect your hand controlling area wherein you get weakness of the hand. It can affect your speech area where you have a problem to speak. It can affect your bladder controlling area. So depending on what area you get affected, you will have the symptom. So what we have done is, we have done a simple slogan which World Stroke Association has put forth to educate the people is called FAST, F-A-S-T. FAST is face. Supposing in your house or in your neighbor's house or in your office, if you notice somebody's face is drooling to one side, that can be a sign of stroke. A is arm drift. When you ask the person to lift his arm on one side, it drifts down. That can be another symptom of a stroke. Then if somebody, S is speech. If somebody's speech is different, he is slurring, he is dysarthric, or he is finding it difficult to speak, that can be another symptom of a stroke. And time is time to immediately rush him to the hospital. So this FAST, F-A-S-T, is used by all neurologists and educationalists as far as the stroke is concerned to make the public aware, to identify the stroke at the earliest. Important thing to stress here is, if you identify the stroke symptoms early, even you may be wrong also, but take him to nearest hospital where facilities to treat stroke properly are available. And if it is stroke, he can get the best chance of survival and avoiding disability. That is most important. And other things are, many people want to know how to control, if possible, prevent stroke. Well, stroke, there are risk factors which can predispose you to stroke. The most common risk factors are hypertension or blood pressure, high blood pressure. Second one will be diabetes mellitus or blood sugar high. Third one will be alcohol consumption, high cholesterol, excessive smoking, and obesity. These are some, of course, heart diseases. If you have any cardiac issues or heart-related issues, they also can predispose to you. So, number one culprit which gives rise to stroke susceptibility is the blood pressure or high blood pressure. So, stroke can be prevented to almost 70 to 80% if you manage your risk factors. Especially 70% of the risk factor is contributed by hypertension. Remaining things contribute about 30%. So, blood pressure, even 2 millimeters of blood pressure reduction will also give rise to almost 30% reduction of stroke incidence. That is the importance of knowing about the hypertension. So if you control your risk factors, you may be able to prevent your stroke.